Hello everybody, welcome to another presentation of our life-changing work here at London Dental Specialists. I want to reassure you that you have come to the right place if you would like information about how dental implants can change your life. So let's get into today's presentation. It's about an 85-year-old long-standing patient of my practice who came to our practice complaining about a fractured upper front tooth, and we'll get into the pictures in a second. But medically, she was fit and well, even though she was 85. And the only things of note from a dental perspective were that over the years, she had often joked that although I've owned the practice for 10 years and she'd been a patient of our practice for about 30, she has broken all sorts of crowns and fillings that all my specialist colleagues have placed in all of that time. Let's have a look at the picture of her tooth. As you can see, this upper right front tooth is fractured. So I then took two new x-rays, as you can see them here, and you can see just up here that there's an abscess on the upper left front tooth and a potential abscess on the upper right front tooth, in addition to the fractured tooth that you can see here. And as you can see, there is very little tooth material above the gum. That really means that if I'm trying to put a crown or a filling or something on that tooth, there's very little for it to hold on to. Now, when I see cases like this, I start by asking myself, why did the fracture occur? Because usually, 9.5 times out of 10, the reason why a tooth fractures, particularly a front tooth fractures, is that the whole bite structure is uneven, and therefore the front tooth is overloaded. Or, quite frankly, it's the same with back teeth. The only way a tooth will fracture is if it is overloaded. Now, overloading occurs for a couple of reasons. Number one, the bite forces are not being spread evenly around the mouth, so that one or two teeth are taking too much force. Or number two, which has the same effect as number one, there are multiple missing teeth, okay? And that means that the other teeth are having to take the weight of their own, or the weight of their own biting force, and the weight of the biting force of the missing tooth. So what I really mean is that if you look back here, you can see that on the lower right, there are multiple missing teeth, and on the lower left, there are multiple missing teeth. I'm also going to show you this x-ray of two dental implants that I personally placed about 4 years ago, because again, about 4 or 5 years ago, I placed a load of white fillings, essentially composite bonding, on a lot of her teeth just to try and deal with some of the wear that I was noticing. And back then, I did say to her, look, if we're going to get a decent result, if we're going to get a long-term benefit from the composite bonding, I need to add 2 extra teeth, as you can see in the upper left. So, what diagnosis did I make? The diagnoses were as follows. Number one, an abscess on this upper left front tooth. I also noted what we call an equigingival fracture. It's a posh word for saying the fracture occurred at the gum line of this upper right front tooth. So remember what I was saying a second ago. Tooth is fractured. Why has it fractured? Usually it is overloading. So let's look specifically in her mouth. How many back teeth does she have? Multiple missing back teeth. How am I going to deal with the issue of multiple missing back teeth, bearing in mind that she's 85 years old? The other question that I have to ask myself is, at 85, she needs a treatment plan that is pretty robust, that will be able to tolerate any changes in her manual dexterity that could happen in the next 5 to 10 years. I also have to factor in that whatever it is that I do in her mouth really must not decay, because decay due to sugar is one of the major issues that patients have to deal with over their lifetime. Patient and I had multiple conversations about the things that were going on in her mouth. Remember, abscess on this upper left front tooth, potential abscess on the upper right front tooth, and this broken tooth that she came in for in the first place. Her options, therefore, are just a dental implant to deal with the broken tooth. That would have worked very well, but it doesn't in any way factor in the issue with overloading, especially when you think about the fact that these other two front teeth are also problematic, plus the fact that she has missing teeth. So we're either going to deal with all of those issues, or we take the more pragmatic approach, which is those missing back teeth that you can see there and there have been missing for a very, very long time. She's had some problems, but not that many. So rather than putting her through the whole rigmarole of having all of those teeth fixed, why don't we do the second option, which is deal with the fractured tooth, deal with this other tooth with the abscess, okay? And also solve the problem, the question mark on this upper right front tooth, which is ultimately what we ended up doing. We, as you can see here, the upper right front tooth is now replaced, and there are two new crowns on these upper front teeth. And that's where we started. You can see broken tooth here, filled in there. And what I essentially did was I took out those three front teeth. I then placed 3 dental implants, which you can see on the x-rays down there, and that's just a different x-ray from another angle. Look at this picture here with those 3 teeth all glued together so that we can spread the biting force across all those 3 front teeth. And she had a wonderful result. As you can see, she was very glad to come in the morning with the broken front tooth here and leave the practice that afternoon with these 3 teeth all splintered together. She would rightly, and I'm sure you would rightly ask, what's the prognosis of this? What are the chances of this restoration, this new set of teeth lasting the next 5, 10, the rest of her life, essentially? The things to think about are gum disease. Well, at 85, it's unlikely. If she was going to get significant gum disease, it would have happened by now. Decay. The other reason why replacing these teeth with dental implants was a good idea is because implants don't decay, whereas teeth do. More fractures is a problem. You see, she has a history of fracturing things. But having these 3 teeth all splintered together with dental implants does reduce that risk. Doesn't eliminate it. The only way of eliminating that risk will be to fill in the teeth at the back there. But the patient and I agreed that this was over treatment. And as you can see, this is the final result with these beautiful, beautiful, beautiful new teeth. She was extraordinarily happy. Okay, start to finish, the treatment time was about 4 months. As you know, with every single dental implant in London Dental Specialists, you get a 10-year warranty because we use the very best materials and techniques. So why not take a leaf out of my patient's book or get your dentist or your hygienist to refer you if you have any current dental implant problems. My team and I are looking forward to helping you with your own unique dental problems. Thank you very much.